My name is Sanjay Gupta. I'm a cardiologist in York. Today's video is entitled More Than a Diagnosis: The Dignity We Owe Our Elderly Patients. So today I wanted to speak about something that is both simple and radical. Not a new treatment, not a diagnostic breakthrough, but a question of how we speak to people, especially those who are older, more vulnerable, and often overlooked. A few days ago, I came across a comment by someone named Suzanne. She'd written it on my Facebook page, and it stopped me in my tracks. Suzanne wrote, "The dignity of being addressed directly, and not in a sing-song, falsely cheerful way, and of speaking for oneself without being cut off, especially when family and other carers are present, goes a very long way indeed." And she's right, it does go a long way, and far too often it doesn't happen. There is a quiet cruelty that sometimes creeps into the way we treat older patients. We start speaking about them instead of to them. We raise our voices unnecessarily, or worse, drop into a condescending sing-song tone, as though kindness must be performed like a nursery rhyme. We interrupt, we rush, we assume they don't understand, or we defer to their family, as if they've ceased to be capable of speaking for themselves. And all of this may not be intended as disrespect, but it feels like disrespect, and that's what matters. Every human being, regardless of age, diagnosis, or frailty, deserves to be spoken to directly, to be listened to without interruption, to have their preferences and pace respected, to be treated not just as a patient, but as a person with history, humor, grief, and grace. These are not luxuries. They are the bare minimum of good medicine. And when we fail to offer them, we're not just being inefficient, we're being inhumane. Dignity is not a side effect, it is the treatment. What the elderly most often need is presence, not prescriptions. They need to feel seen, not be screened. I personally have watched older patients light up when they're addressed by name, asked their opinion, given time to answer, and allowed to reminisce without being hurried. These moments are small, but their impact is enormous. Because when we do this, we're not just respecting them, we're telling them you still matter, you still have worth, you are not invisible here. There is a certain tragedy of rushing past a life. It's ironic, isn't it? We spend 15 minutes in a room with someone who has lived 85 years, and we speak to them like we're trying to get to the end of a queue. We forget that this person has survived wars, raised children, buried friends, lost memories, and we treat them like a checklist. That is not care, that is transactional medicine. So to my colleagues, to all our medical students, to carers, to families, I think we can be better. Let us speak to the elderly with the same reverence we would want for ourselves when our hair is grey and our hands shake. Let us not infantilize them. Let us not brush them aside for the sake of efficiency. Let us remember they taught us. They built what we now take for granted. And now they need us to return the favor with gentleness, not pity, with presence, not haste. The dignity of being addressed directly, the dignity of being allowed to speak without interruption, the dignity of being treated like one's story still matters. These are not extras. They are the very heart of medicine. Let us give them freely, because one day we too will be on the other side of that conversation. Thank you so much.